This at 6, an interdisciplinary team of global experts suggesting COVID-19 numbers are going to continue to rise here in the United States, including the Chicago area.
So joining us now to talk about this is Dr. David Rubin. He is the director of the Policy Lab at Children's Hospital of Philadelphia. Doctor, thank you so much for joining us.
Sure.
Is the reason for the rapid rise right now because people are staying inside more, or because we're not wearing masks, or what do you attribute that to?
It's a combination of all the above. I mean, I think we've been saying in our team since last spring, there was significant evidence that there was a seasonality to this virus. In colder weather, whatever people thought they saw this summer in terms of hospitalization rates, in colder weather, this virus likes to propagate more efficiently. It suspends in the air longer. People are coughing. The spread of this virus is much more efficient, and people can expect to see higher doses. And then you have people moving indoors. And then you have pandemic fatigue, and all of that equates to higher rates of infection, but not just infection, but hospitalizations as well. And we're seeing more evidence that ICU use is increasing and people are being put on ventilators again. This is a significant concern as we are heading deeper into fall and early winter.
Well, Dr. Rubin, we've been talking about this for the last couple of weeks here, so it's not a total surprise. Here in Chicago, we're told that there is enough room at the hospitals and enough intubators and things along those lines. But tell me a little bit about when you foresee us finally starting to emerge, when we actually will turn the corner, as many have said we are starting to do. When do you see that really happening?
Well, first, to your first comment in terms of ICU use, I think the concern is that, a big calculus right now is we'll wait until the ICUs are full and then we'll make a change. But by that time, there's usually a 14-day lag between the rising infections and when hospitals fill. And so if you make the decision when you're 90% full in your ICUs, you've got 2 or 3 weeks where you're going to get pounded. And that's what we worry about, is we're going to exceed healthcare capacity, and we're going to see concerns about people not having access to care and having to ration care if we make the decision too late. And that's why sensible restrictions, like the ones we talked about, we know this is coming from informal gatherings this time. Restricting the size of gatherings is incredibly important as we move into Halloween. And as to your question, about how long this will last, I suspect we're going to have a very difficult winter. We need to kind of continue our vigilance through the winter and pretty much limp towards warmer weather and hopefully a vaccine in the late winter and early spring. And it's going to take a concerted effort by everyone in the community if we want to get there.
Do you think that people are being more complacent now, and what can get people, get out of this COVID fatigue, as you say? And also, is it going to be worse, or is it going to be about the same as it was back in March?
Well, it's hard to tell, but I can tell you what's going to change is people are going to see the rising hospitalizations. They're going to hear about loved ones and friends who are impacted in this wave. And while there's some evidence to suggest that our treatments have gotten better, the amount of disease burden in the community is significantly greater than we saw in the spring. And I do believe that as we see really high incidence of cases, we're going to penetrate protocols that have been designed to protect long-term care facilities, that I worry that we might see something similar to what we saw in the spring, or perhaps even worse. And people don't understand that what they saw in the summer, the up, the down, maybe the hospitalizations aren't going up, is not what they're about to see in the winter.
In the last few seconds we have left, we understand you came out with a new revised policy for in-person learning. Can you briefly share where you are as far as that's concerned?
Well, I think school districts around the area, particularly in your suburbs, are going to be facing very challenging decisions if they've not faced them already. And, the most important thing is we have seen good evidence that schools can remain open, particularly for younger kids, particularly if we're not seeing in-school link transmission. Like, we're seeing a lot of transmission among teachers, among students, but it's happening during these informal gatherings outside of school. But we suspect there are higher levels of community incidents where we might start to see in-school link transmission. If we start to see that, we need to start thinking about reverting to online learning. Certainly, if you don't have enough teachers because too many are out sick or they're on quarantine, you can't have a functional school day. And so each school district locally has to consider what's going on with their local rates, how functional their ability is to have a school day. And if they have to revert to online learning, We'd encourage them to consider keeping their elementary school age kids and their special education students in class if possible. And certainly, we've been recommending continuing extracurricular activities if you do need to revert to online, because we'd rather have them supervised and regulated the way our schools have done such a terrific job trying to do this, rather than moving to more informal unregulated circumstances.
Dr. David Rubin, a lot of insight there from the Children's Hospital of Philadelphia. Thanks for your time tonight.
Good luck.
You too.
Thank you too.